on the Health Watch for you this morning, the White House recently touted a simple drug as a treatment for some children on the autism spectrum. But as Dr. Sanjay Gupta reports, the American Academy of Pediatrics has warned against the drug's wide and routine use in children with autism, saying more research needs to be done.
This is sweet little Jose. He's 4 years old. When he was 18 months, he was diagnosed with autism.
Look at this!
And every week since then, he has worked with a team of therapists to try and strengthen his speech
Jose.
and motor skills and social awareness.
His world was like this big, like just, well, physically, he's right here. His world was like this big. Rarely noticed other kids. If he did, he'd play like next to him.
But then something changed. Jose's guardian, Keith, said the last 6 months were somehow different. And he thinks it was because of a new medication Jose has been taking.
I started doing some research, and I came across in December a news piece about this Leucovorin.
Leucovorin. It's actually a pretty simple drug, a form of folate, vitamin B.
The third day after we started it, he started babbling so much.
Okay.
We have long known that folate is essential for brain development. What is new is the recognition that some kids with autism have these antibodies blocking the receptor that lets folate enter the brain. As a result, they have something known as cerebral folate deficiency. But leucovorin, a slightly different form of the vitamin, is able to use a different pathway to enter the brain.
Grape serious.
He had a personality, but you had to draw it out. And trying to have anything reciprocal with him was just not happening. Now we have reciprocal conversations. What is that?
T-R-L-O-L-L-I.
Trolley.
Trolley, please.
President Donald Trump and his health secretary, Robert F. Kennedy Jr., publicly recommended the drug.
The FDA will be updating the label of an existing drug to reflect potential benefits in reducing some autism symptoms.
Since the president's endorsement, interest in leucovorin has skyrocketed.
My first reaction was like, better get a refill in. Supplies are tight.
At the FDA's request, GSK, which is the maker of the original name brand leucovorin, said it will be submitting an application to update the drug's label to include use for patients with cerebral folate deficiency. Do you treat something like leucovorin differently because we're talking about autism, something that doesn't really have a therapy?
I think because it's safe, it will go through a different process. And because it's been around for nearly a century, it will go through a different process. And because of the urgency of the unmet public health need of the burden of autism in society.
Normally, companies do need to run large trials before a label can change. But in this case, the FDA says smaller existing studies may be enough, even though the data is limited and still needs to be replicated.
All right, here you go.
The agency notes that they have reviewed 23 studies since 2009 and found clinical benefit in 85% of patients with the deficiency.
The issue is whether or not that is sufficient evidence for the FDA to approve this for treatment of autism when there's very little efficacy data.
But Alicia Halliday, Chief Science Officer for the Autism Science Foundation, is mostly worried about this, creating too much false hope.
The indication that the FDA put out was for autism with cerebral folate deficiency. I don't think that that was understood by the autism community, who feels like this is a panacea for all people with autism. Most people with autism do not have a cerebral folate deficiency.
Keith is convinced that it helped Jose, but it's still not clear what that means for everyone else.
That was Dr. Sanjay Gupta reporting. A CDC report says about 1 in every 31 children was diagnosed with autism by the age of 8. In 2022, that's up from 1 in 36 in 2020.